Okay, so this is your sample on how to do the head to toe. Like y'all to meet my husband, this is Tim. He's been voluntold to help out tonight and he's good with that. So we're going to go ahead and get started. Okay?
I was promised a breakfast too.
Uh-huh. All right, so the first thing you're going to do, you're going to make sure you've got all of your equipment ready. Knock on the door, knock, knock, knock. Hello, can I come in?
Come in.
Thank you. All right. Now, my name is Mona. I'm going to be your nurse today. I'm going to be, can you tell me your name, please?
Tim Bierbauer,
Date of birth?
January 17th, 1945.
Okay, and you're going to check that against the wristband. All right. Doing an exam on you, head to toe. It's going to be involving a little bit of touching. Are you okay with that?
Yes.
Okay, great. This is just going to take about 15 minutes or so. All right, thank you very much. So now, washing my hands, and you can verbalize this when you're doing your checkoff. You're going to be scanning the room, so you can verbalize. I'm scanning the room. The environment looks safe. You can provide privacy for the patient. All right, so in looking at the patient, facial expression looks symmetrical. It is within normal limits. We're going to check cranial nerve 7. So would you close your eyes for me, please, and tell me when you can feel this.
Now. 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 Now.
Okay, good. Great. Do you know where you are right now?
Yes.
Would you tell me?
In my living room.
And can you tell me about what time it is?
It would be about 8:15.
Okay, great. All right. So patient is alert, oriented to person, place, time, and situation. Verbal and nonverbal expressions appear to be congruent, and the patient is following commands. Personal hygiene looks to be within normal limits. Now, at this point, you would be checking the vital signs. I'm not going to do this here because I don't have my blood pressure cuff here at home. So you'll check vital signs. We are not doing a 2-step blood pressure. It's just a regular old blood pressure when you do this, okay? When you're doing your vital signs, don't forget to ask about, is the patient in pain? All right, so now you've done your vital signs. So you're looking at the skin color, which is consistent with genetic background. Skin temperature, so use the back of your hands. And you can do the legs at the same time if you'd like. Okay. All right, so skin turgor is warm and dry, or skin temperature is warm and dry. Skin turgor is within normal limits. Nutritional status looks good. No visible skin lesions or incisions of any kind. Scalp and hair look to be within normal limits. Hair is evenly distributed and it's a very pretty silver gray color. Again, face is symmetrical. When we're checking visual acuity, you're going to have a handheld Snellen chart, and you're going to use that. So you're going to tell the patient, hold this about here and read the lowest line for me, please. And the patient's going to read whatever one they can read. And then you're going to take the chart back and you're going to go, okay, patient's vision is 20/20 with glasses. Check, I need you to take your glasses off for me, please. And I want you to look straight ahead as I do these tests. Okay. So when you are checking pupillary response, again, I'm old school. I put my hand here. You're going to flash the light into the eye and look at the response over here. And then you're going to do the same thing here. Okay. All right, now follow my pen light with just your eyes. So now I'm checking for the cardinal fields of gaze. and accommodation. Okay. Eyes are Perla, EOMI. So then you're going to check vision side to side. So again, follow my pen. Okay, cranial nerve 3 is intact. All right, inspection of the middle and external ear. So I need you to look here. You're going to use your pen light. Turn that way. There you go. And then turn towards me. And you're inspecting, and you're looking there. Okay. Now I'm going to do a whisper test, so I'm going to go behind you. I want you to cover one ear and repeat what I say.
Chocolate sundae.
And cover the other ear. And the same thing. Strawberry ice cream.
Strawberry ice cream.
Okay, so cranial nerve 8 is intact.
And hearing aids are working.
Yay! All right, so now we're going to check cranial nerve 1. So can you tell me what scent is on this cotton ball? Make something up.
Tobacco.
Tobacco. Okay, good. So cranial nerve 1 is intact. I want you to cover one nostril and breathe in. Tell me, any problems?
No.
Okay, cover the other nostril, breathe in. Any problems?
No.
Good. All right. So nose is patent. Now we're going to take your glasses off again, please. We're going to palpate sinuses. Any pain or tenderness there?
No.
Okay. All right. Frontal and maxillary sinuses are within normal limits. We're going to be inspecting the lips. Open your mouth, please. Tongue, buccal mucosa, all within normal limits. Close your mouth. Can you clench your teeth for me, please? All right, that's within normal limits, cranial nerve 5. And stick out your tongue. Okay, midline, that's cranial nerve 12. Okay, inspecting the trachea. Trachea is midline. We're going to check the carotids one at a time. Make sure you get the right spot. Now we're going to assess lymph nodes. Preauricular, postauricular, submandibular, and submental. All are within normal limits. Okay, now since we are on my couch, it is a recliner, so we're going to put this at an angle here. We're going to recline the patient here to about 45. Okay, so now we're going to check for JVD. So, can you turn your head that way for me, please? Okay, now look at me. Okay, no JVD present. We can check the costal angle. So you're going to find the xiphoid process. You're going to find the ribs. And they are at a 90-degree angle. Okay, so now we're going to listen to heart sounds. And when you do this, make sure you're going in the right spot, and you're going to verbalize when you do this, okay? So. All right. Just relax. Aortic, pulmonic, Erb's point, tricuspid, and mitral. We're going to check peripheral pulses. So, and you can do these both at the same time. So, brachial, radial. Okay, posterior tibial pulses. You can do these, and they're on the inside of the ankle, behind the ankle bone. And dorsalis pedis, they're on top of the foot, and you can check those. You can check them both at the same time. Again, you do not have to stay there for a full minute. We're going to check capillary refill. Can I have your hands, please? And you can check both hands at the same time. Capillary refill is less than 2 seconds. Now we're going to lay the patient down as much as we can with the recliner. Okay, so now we're going to listen to valve sounds in all 4 quadrants. And you can call these out. Okay, you can call these out as you do them. Right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. Now you're going to listen for the abdominal aorta, so you're going to find the xiphoid process. Go a little bit underneath there. And then you're going to find the renal arteries. They are a little bit lower and a little bit to the side. And you're listening for any bruits in any of those 3 areas, which I do not hear any of that. Okay, so now we're going to percuss in all 4 quadrants. And we're going to do light palpation in all 4 quadrants. Any pain or tenderness?
Nope.
Any pain or tenderness?
Nope.
Okay, so for this now we're going to set the patient back up. So, I would like you to do what I'm doing, okay? So I want you to turn your head side to side. Okay. Ear to shoulder. Ear to shoulder. All right. Now I want you to shrug against resistance. So push up, shrug your shoulders. Okay, cranial nerve 11's intact. And again, all I'm doing is I'm standing here. I know you can't see me. But, all right, so I want you to flex your elbows. Do this. Do this. Do this. All right. Okay, good. Knee flexion and extension. Wait. Okay, so while you're sitting there, flex and extend the knee. Other leg. Okay, so I want you to raise and lower this leg. Okay, and down. And this one up and down. Great. Okay. All right, now would you stand up for me, please? Okay, so if you'd start at that end of the room, and I want you to walk towards me 5 steps. Now turn around and heel to toe. And you can put your arms out if you need to. Okay. All right, good. Okay, now, so now we're going to perform the Romberg test. So I'm going to stand here. Close your eyes for me, please. Now this would really take 20 seconds. We're not going to do 20 seconds. Okay, open your eyes. All right, Romberg test is within normal limits. Okay, have a seat for me, please. Okay, so now we're going to test some nerves things. So I want you to close your eyes. This is sharp and this is dull. Okay, I want you to tell me the difference, okay?
Oh, that's sharp. That's sharp. That's dull. That's dull. That's sharp.
Okay. All right, good. Keep your eyes closed and hold out your hand. Tell me what that is. You can close your fingers. Tell me what that is.
It feels like a pen.
Yes. Okay, that'll work. And I'm going to write a number in your hand. I want you to tell me what it is, okay?
Without looking?
Without looking.
Uh-oh. Three.
There you go. Good. Okay. So now we're going to check some reflexes. So you can open your eyes. Checking reflexes. So it's the biceps. We'll check triceps. Relax. Relax. You're not relaxed. Okay. I need you to put your arm up higher.
I wasn't born relaxed.
Relax. Relax. Okay. Triceps and then patellars. And with patellars, make sure that their feet are off the floor, which is not going to happen here. No, because you need to be relaxed. Okay, so with patellar reflexes, make sure that their feet are off the floor. Okay. Which isn't going to happen at my house, but it'll happen there when you've got the hospital bed. Okay, so deep tendon reflexes are within normal limits. Do you have any questions or concerns regarding this exam?
No.
Okay, the bed is low position and all the wheels are locked. We've made sure that they've got the call light next to them. They've got their phone on the over the bed table. Open up the privacy curtain and the door. Wash the hands with hand sanitizer, and then you can leave the room. So that is the end of the exam. All right, so that's the end of the exam. Should take you about 15 minutes or so, maybe a little bit less, depending on how much you practice. Please make sure that you are already starting to work on this. And as you add labs with your different body systems, you just incorporate that so that you're getting all of your systems in. And that's pretty much it. Okay. If you have any questions, you know where to find me. But thank you very much. Have a good time. Bye.